And I'm going to be brief because I don't think there's much time left. And I know Gia and Angela and Natalia are going, oh my goodness, the group needs to get together and also discuss. But let me just say a few words. Actually, just to throw out there, again, fantastic briefing by the conveners. I don't know if any of you caught an acronym, at least I come away with one. What's distinguishing about AI as a technology? When you look at it carefully, it spells cold. And in our current environment, I thought that was quite interesting. Complexity, opacity, learning, and distributedness. So it's easy to remember anyway.
Yeah. We have a paper recently on this. We presented at EGLE, so we're very happy to share that. Everybody's interested. Have all that written out.
Great.
It's very well received.
So very briefly, the work that I've been working with colleagues like Eva Oborn and Oliver Salg and others, it's a global project on smart hospital future. I'm just going to say a few words about the UK-based project, which really tries to connect with the policy of our soon-to-be stepping down Prime Minister, Boris Johnson, who has had 40 hospitals in the next 10 years, the biggest build since the 60s in the UK. And the challenge that we have in looking at this is that the right way forward? How do you go? Is it about building new infrastructure, or is it about taking digital technologies, enabling new service pathways and transforming care, and then looking at how that interacts with the built environment and going beyond hospitals to thinking about different levels of care from the homes, which we see a very interesting development. If you think about, Foucault, birth of the clinic, now we've got 200 years later, some re-entry back into the home, which I think is fascinating. And so we're very interested in that, with how AI intersects. How does AI enable service innovation to enable hybrid models of care and new ways of tackling this great and difficult issue, which has been mentioned by many. So we actually got involved because the director of digital medicine, who I happened to teach a course on about 10 years ago, said, I guess back to the dinosaur, maybe you can still help us before you get extinct. And so what was interesting was noting how in that hospitals, they had algorithms that were famous, published in Nature Medicine, and had a lot of reputational capital. But what on earth do we do with them inside? And I think we've heard this story over and over in some senses. And I think it's a very important story of how we understand then the trajectory of AI in hospitals and in practice. So we are very much charting out, not, I liked the ecologies, because that's indeed how we look at it, the ecologies of AI technologies and the synergies, because you really have to understand it, especially when you have punctuation, as we have seen with COVID, of the acceleration of technologies like telemedicine, which have actually, at least in our setting, allowed for pockets of AI to be developed and driven, because this is an eye hospital. Images are what's important. And so the opportunities of getting more and more images and ways of getting the digital data to build the models to train and then implement has accelerated. So we really need to look at that interaction. So that's a key question that we are looking at, trying to understand what are the trajectories by which AI is developed and implemented in hospitals in practice, and how do we think about orchestrating health ecosystems as they change and how we transform. So the ideas, just to link into multi-stakeholder engagement, and co-creation, those are key themes for us. Service innovation, effects of AI, and implementation on the organization. More I could say, but I'll try and come back to that to try to hold to my being brief and come back to the question. Thank you.